Anna, and while she's setting up, maybe by way of brief introduction, she has had a double career, isn't that right? As a geneticist and now also as a social scientist, right? Okay, please go ahead.
My name's Anna. I'm a senior social scientist working at the Wellcome Trust Sanger Institute in Cambridge in the United Kingdom. And I'm going to be describing the empirical research that I've been conducting over the last 4 years, exploring what people want in terms of feedback, what are their thoughts about genomic research, what would they like to know if they were taking part in genomic research. I'm part of the Deciphering Developmental Disorders team, and I'll explain a little bit more about that project. So I just thought I'd start with a very, very brief case study. So this is Sarah and her parents. She's the little girl here. She has an undiagnosed developmental disorder, and the testing that she has received on the National Health Service has not revealed a diagnosis, but it's thought to be genetic. And so she's able to participate in a research project conducted by the Sanger Institute, where she can get an exome sequence and hopefully an answer to her developmental disorder, the reason behind it. So she can take part in the Deciphering Developmental Disorders project. And as part of this piece of research, it's a beautiful collaboration between a research setting and a clinical service. And as part of this, hopefully we'll be able to unpick a diagnosis for her. And so what we're doing is gathering genomic data from Sarah and her parents, and we're clearly looking at known developmental disorder genes, and we're looking at new developmental disorder genes. But by virtue of having a sequence there, we could choose, through bioinformatics, to look at other information if we so wanted to. So I'm calling that an incidental finding. So for Sarah and her parents, if we wanted to, we could choose to look at, say, the BRCA1 gene. That's implicated with adult onset breast and ovarian cancer. Now, in our research project, we took the decision right at the beginning that we would not be sharing incidental findings, we would not be exploring those, we would only be focusing on pertinent findings. And because that's an interesting ethical position, we set up the social science project that I'm running to explore that really and to try and gather data on what people think about that position and whether they feel that there is a responsibility in a research setting to be actively looking for certain incidental findings. And as you've noticed already, the terminology is not consistent around the world. So I'm going to use the term incidental finding. The Americans like secondary variant and finding. The European Society of Human Genetics uses unsolicited finding. The Wellcome Trust like health-related finding. You'll also see ancillary finding as well in the literature. But all really talking about the same thing, additional information that's not related to the clinical question that one might be trying to answer through the research project. So the social studies project that I set up aims to explore attitudes towards searching for incidental findings, looking at the factors that influence attitudes and the processes that people want. And I'm going to focus on these first two today. I wanted our research to have a large reach, and to do that, I worked with a filmmaker to try and capture some of the ethical issues raised by genomics and turn those into 10 short films to really try and engage people and get them to be excited about taking part in this. So just to give you some of the context, I'll just show you the introductory film so you can see how that this was posed to people, and this was an online survey that we created.
This ethics and genomics survey asks for your views about several different scenarios that are related to whole genome studies. The context of each scenario is explored in a video clip, and then you are asked to give your views via a short set of questions. This questionnaire can be completed by anyone: lab staff, research participants, and members of the public, doctors and policymakers, and clinical researchers and health professionals. Your responses are confidential, and it should take around 10 to 20 minutes to complete the questionnaire. If you would like to be interviewed to explore your views in more detail, then you can leave your contact details at the end. This research is being conducted by the Wellcome Trust Sanger Institute, based in Cambridge in the UK. The aim is to gather information that can be used to create policy on how genome studies could be conducted.
So we invited people to take part in this survey using direct email invitation. And we also use social media and also traditional media. And the aim really was to sort of hope that people were captured by the films and then they would tell their friends and colleagues and just sort of promote the survey. And that actually happened in reality. So it did sort of go viral. And we had just under 7,000 completed surveys as a result of that. And here's a breakdown of the participants. So we had just under 5,000 members of the public, genomic researchers, so the scientists actually doing this sort of research into genomics. We had 533 genetic health professionals. These were the clinical geneticists and the genetic counsellors, and so people who had a real knowledge, working knowledge of genomics in practice in a health service. And then we had other health professionals, nurses, GPs, midwives, surgeons. And I also had a question in there about, are you a member of a biobank? And we had 276 people who said they were taking part in biobank research. And because this was online, it was available for anybody to complete, irrespective of geography, and we had 75 different countries represented. Just because this is a biobank conference, I just wanted to pull out the data from the biobank participants. This is their socio-demographics. And as you can see that they're mainly female, this is very, very typical profile of people who take part in surveys of this nature. Most of them are recruited via social media. Most of them are very well educated and white. And I wanted to see if their attitudes to all the questions that I'm going to present were different from people who weren't participating in biobank research. And I found that there was no significant difference. So actually what I'm going to present to you is the data from the full group, because irrespective of whether people had taken part in biobank research or not, the views were actually, very, very similar. This profile is also very typical of the whole sample. And so, you might say, well, this is actually quite biased. There's quite a lot of women here. They're all very well educated. But actually, because of the large sample size, we did have, still we had several thousand men that took part and several thousand, of all the other different groups, so different ethnic groups and different, geography. So actually, I was able with the statistics to look at adjusting for all the biases. Okay, so here's the geographical representation. So given the geography, I was thinking, goodness, if we've got people from Moscow, people from Australia, America, Canada, England, surely there's going to be some influence of geography here on attitudes, but not so. I found that one of the most strong predictors of attitude was actually our professional background rather than the country we're from. So genomic researchers, irrespective of where they lived in the world, had more similar attitudes to each other that were not affected by geography, and these were different from attitudes from the public, from other health professionals, and from genetic health professionals. So I've just mentioned about the biases. So one of our first questions was, should incidental findings from genome studies be made available to research participants? And we asked people to imagine, put yourselves in the shoes of someone taking part in research. What would you want to know if you were a research participant? And should incidental findings be made available to you? And most people said yes. They liked the idea of incidental findings being made available if people wanted them. Most likely to say yes were the public. And then you can see the breakdown there of the other groups. If incidental findings were categorised in the following ways, should research participants be able to choose to receive information in these categories? So I wanted to work out whether treatability was important. So the categories ranged from genetics related to life-threatening conditions that can be prevented, carrier information, response to medications, information that might be useful later in life but not necessarily now, or even about ancestry data. What about life-threatening conditions that cannot be prevented, information that's not of serious health importance, and uncertain data? And here are the responses from people saying, yes, I'd be interested in information in those categories. And I grouped together the public, genomic researchers, and other health professionals, because for this question, their views were quite similar. And as you can see, as you move through the categories, there is interest, but the interest starts to sort of tail off as the categories become less usable, I suppose, less important. So what's of most interest to people is having access to data that can be used in terms of prevention for protecting health. They're least interested in certain data. But actually, there's still quite a few people who said, yeah, I'd have uncertain data. I'd have it, this is about me, I'm interested, I'd like to have it. I'd like to compare these attitudes to those from the genetic health professionals. So they followed the same pattern in decreasing interest as you go through the categories, but there's significantly less of them answering positively to this. And I think that really shows you that genetic health professionals, bearing in mind they're the most realistic about how to work with this data in the clinic, they are more conservative with the use of this data. They understand how this works in reality. So the key messages from those two questions are that people want data, that treatability is important, and that genetic health professionals have more conservative views and really should be involved in policy decision-making in this area. Why are genetic health professionals different? One might say they're the most realistic. They're also very aware of the direct impact on them. So your clinical geneticist and genetic counsellor is very used to having to confirm a research result in a clinically accredited lab. They're also very used to explaining this in lay language to the patient and having to do extensive studies to make that a reality for people. I raise this in brackets, are they being paternalistic or exceptionalistic about this data? Big debate on Twitter about this. How far should genetic counsellors and geneticists be, custodians of this data and perhaps holding it back from people? I'll just leave that up for your judgment. One of our key questions in this survey was how far should researchers go to actually provide information? So we framed this in a certain way. Do you think genomic researchers should actively search for incidental findings that are not relevant to their research study and that there may be a cost to doing this? And I just want to show you the film that we created to just describe this, because this really says, and this is the reality, if one was to search for incidental findings to put together a feedback programme, that might actually compromise the research that you're doing. Do people still want data given that caveat? So here's that film.
Some feel that genomic researchers have an opportunity to use their studies to try and identify many different pieces of new information which could be useful to research participants. Others feel that putting the onus on the genomic researcher to offer as much information as possible could slow the progress of their original study. It could also be costly in terms of time and money to do this additional work. Should genomic researchers deliberately search for potentially relevant results that research participants might be interested in? Or do you think it is more important that they focus on the research question they want to answer, only reporting incidental findings if they happen to identify them while doing this research? As the interpretation of genomic information improves, over time, genomic researchers may be able to identify new information that the research participant might be interested in. Do you feel genomic researchers have a duty to go back and reanalyze data to update pertinent or incidental findings?
So should researchers actively search for incidental findings not relevant to their research study? And most people said no. So this is really interesting. This shows that they're placing a value on this information to them. So yes, they'd like data, but actually if it would compromise the research study, then no, they recognise that the research, answering the clinical questions, say, is more important, and they're happy to forgo their data in that situation. So this really gives a sense of what the value is of this information. This really is scope for much more research to work out, actually, would people put a cost on this? Would they be willing to pay for this information? How much do they really want this data? So the key messages from that is that there is no expectation of information delivery at all costs, and that policy and research doesn't need to obligate researchers to share incidental findings. So just to summarise, we've got a very large empirical data set, and currently this is the largest in the world on this area. I haven't presented all the data by any stretch, just a small snippet of it. And all the stakeholders do support result provision, but not at the expense of research. And that attitudes are affected by professional background, and genetic health professionals are the most conservative and definitely need to be part of the conversation about policy decision making on this. Thank you.